Well, it was unfortunate that the OCS came to the meeting yesterday drunk. I don't think that is very normal for someone to come all the way from Timaru all to the headquarters for a discussion with the Cabinet Secretary and the Inspector General of Police and come drunk and sit in front. It is not normal. So it means there must be some problem with the officer. And as I've announced many times, the procedure is to first assess the mental health of the officer, to do the necessary medical tests, and then of course follow on the history of the officer. Some cases are just indiscipline. Yeah, it may not have reached a level of addiction. Where it's in discipline, the disciplinary procedures will take place. The assessment is currently ongoing. The officer was taken for tests in the hospital, and if it's a mental health problem, it will be handled also as a mental health challenge. Of course, that requires some level of reorganization to ensure that the officer cannot, to get another officer to do the commanding work, and maybe redeployment of that officer after rehabilitation to perform other responsibilities. But we have, the National Police Service puts a human face to these issues. But this is not an excuse for police officers to come to work drunk. This is only if we establish that the officer has reached a stage where it's a mental health problem. But if it was just, drunk for the sake of it, for whatever reasons, then of course the disciplinary processes will take effect, and the relevant disciplinary measures will be taken by the National Police Service.